Good evening, everyone. Welcome to today's session. On behalf of Diabetes Awareness and you, I extend my warm welcome to all our viewers joining with us today. Today's topic is optimizing immunization in geriatric diabetes mellitus, recent perspective. A very important discussion highlighting preventive healthcare and vaccination in elderly individuals living with diabetes. We are truly honored to have with us Dr. Dhires Kumar Chowdhury, sir, a renowned community physician and public health specialist with over 2 decades of experience in geriatric care, community health care, and public health initiative. Sir has been a pioneer in home-based healthcare service in Eastern India and has actively contributed towards elderly care, community awareness, and healthcare accessibility. Thank you, sir, for joining with us today. We are looking forward to today's session, to this insightful session. Thank you. Now over to you, sir.
Thank you. Good evening, everyone, and thank you, Suparna Madam, for nice introduction, and also Mr. Indrajit Mujumdar, who actually referred my name to diabetes awareness and you. And the Day organization is extremely working for the awareness of the diabetes, and it is extremely necessary nowadays. And I must congratulate them and appreciate them for this endeavor they are doing for a long time. So I'm also privileged and honored for having this opportunity to share this very important and relevant topic uh, to you, that is optimizing immunization and geriatric diabetic mellitus patient with the recent perspective. I am the fellow of the Geriatric Society of India. The Geriatric Society of India is a national-based organization for the geriatric physicians, those who are engaged in the uh, treatment of geriatric patients. And not only the geriatric physician, the allied all healthcare, other specialists, healthcare personnel, and even the non-paramedical geriatric allied healthcare personnel are also members of this organization. And Madam already told that I'm related with the geriatric care, especially the home-based care for more than 2 decades. And, uh, I'm the founder, member, and director of the Bangla Healing Health Foundation that is working for the home-based healthcare support since 2007. And with my experience of nearly 2 decades in the geriatric field, individually and through my organization, I have seen the many patients in the pediatric age group. They are suffering from the diabetes mellitus. And diabetes, as you know, that globally, the India is the capital of the diabetes. And if you know, that not only these are affected the younger or the children, it also affected the older age group also. And as for the uh, data of longitudinal assessment of that is the LOSI, the study, that study shows that it is nearly 14% and nearly 15% of the geriatric patients or geriatric age group, rather, they are suffering from the diabetes mellitus. And it is much more higher rate, nearly 30% in the urban area. And rural area also, the elderly people, those are in the rural area, they are also suffering from the diabetes mellitus. There is a misconception or some myth is there that the elderly or the rural people are not suffering from any chronic diseases or they are derived from the chronic diseases or the percentage is low. But as my experience of working in the peripheral part of the Bengal, especially in the Sundarban, in the jungle, I have seen many of the elderly patients, they are suffering from the diabetes mellitus along with the other chronic disorders like hypertension, osteoarthritis, and many other related diseases. But diabetes are there, and even sometimes the first time they actually the diagnosed in a very high sugar level, 350 more than 400, that sort of level, and they don't know about that diabetes. So awareness on diabetes is very much important, and what the Day organization is doing and an excellent job, and it is very much necessary. The urban people are more or less aware, but some people are not aware even. But the rural people are unaware, and due to unawareness, the prevalence of the diabetes mellitus is increasing day by day in Bengal, in our country, and as well as globally. But today's aspect is the immunization aspect, and what is the necessity of the immunization in the geriatric diabetes mellitus patient. And as you know, as a geriatric practitioner, the immunization I have seen the patients, those who have taken the vaccines, are much more better. Their quality of life are much more better than those not taken the vaccines. So this is my real experience, not by theoretical, not by any related experience. So I have seen many of my patients. And through our organization, we have vaccinated nearly 300 to 350 senior citizens. So we have seen that changes of before pre-vaccination and post-vaccination. So I must say the vaccination is very important. And in this aspect, the next slides are there. So the growing challenge, first is the diabetes, then if it is related with the aging, then it becomes double vulnerability. It's not that I am here to give some messages that panic you. No, this is not for that. This is just for awareness and for inspiring you. It's that I am also the diabetic patient with 18 years of diabetes, and I have many other disorders, also heart-related complications also. I never depressed about that. Okay, diabetes is there, okay, that is there. It's actually your mentality, your mental booster, and requirement is the following the advice of the doctors, the nutritional aspect and other aspects, and the positivity in you. That is the main, the booster, main, I say main medicine. So diabetes and aging, the double vulnerability, global elderly population is rapidly increasing. It's now in India, the 15 crores elder populations are there. And if we compare these 15 crores, that we have realized that how much importance of these 15 crores elder population. Actually, the only one country in Europe is more than 15 crores. The total entire population is more than 15 crores. That is more than our elderly population. That is Russia. And in Asia continent, only the 5 countries more than 15 crores population, including India. So this 15 crores population is the geriatric patients, and about that, if the 15%, 30% of that 15 crores are suffering from diabetes, so how much load is there? So the global elderly population is rapidly increasing. Diabetes prevalence rises, we have already mentioned. There is due to the diabetes, due to aging, both there is a reduced immunity and there are multiple comorbidities. The geriatric patients, they don't not only have the diabetes, but along with that, there are several comorbidities are there. Hypertension is there, heart-related complications are there, neurological problems are there, osteoarthritis-related problems are there, other many Parkinson's may be there, dementia may be there, cognitive decline, other complications are there. So many problems are there along with the diabetes, and that's why due to these multiple comorbidities, due to intake of the multiple medicines, because of the multiple comorbidities, what we say that polypharmacy is a very emerging factor of the geriatric age group. That also reduces the immunity along with the natural decline of the immunity. So this is very important aspect. The higher hospitalization and infection-related mortality is also in the geriatric age group, especially in the diabetic geriatric age group. So, what is the key message? The key message is infection prevention is as important as glucose control. Not only our aim should be the only controlling the diabetes is not enough. Along with that, we have to give emphasis on this aspect also, that is the prevention of the infection. So this is very important part. Why actually immunization matters in the elderly diabetes? These are the actually the clinical or the scientific things, but you may know because we have many of obviously in the audiences of they are science based or they know the things. So our neutrophil actually main the functioning part of the our WBC that helps in our immunity. So impair neutrophil function and among that T cell, so that is also very responsible that reduced T cell response. The elderly patients are prone to the chronic inflammatory diseases. That's why that any itis related, arthritis, gastritis, that sort of any related anything what is ultimately end with itis that indicate actually the inflammation. That sort of complications are much more in the diabetic patient. And we have seen a diabetic along with the elderly patient and the poor wound healing. It is another factor that is because of the diabetes and along with the your aging aspect is also result in that. So, what is the result of this? That effect? The effect is increased chances of pneumonia, increased chances of influenza complication. Influenza, what we call common cold, that may be very commonly happen. But in case of elderly age too, and also in the children, this simple influenza can lead to multiple complications, severe complication, leads to even increased mortality both and morbidity. There is a chance of increased sepsis. Sepsis, you know, the when the actually when the infections is ultimately the systemic infection, not only localized into the local part, it's spread to the blood. Then it's called sepsis. So increased chances of sepsis, increased chances of hospitalization. So that is another important. So vaccination should become a vital sign in geriatric diabetic care. I have to not only mention the geriatric diabetes care, I should mention the geriatric care. So vaccination is now become the vital sign of geriatric care. So especially the geriatric diabetic care. Then immunosenescence. So that ultimately what happened in the immunity aspect actually reduce adaptive immunity. So immunity that helps adaptation with our body to the changes of the environment. That may be internal changes in maybe the internal environment. Our body, there is the internal environment and external environment. So we have to adapt both along with this internal as well as external. So these both adaptivity may reduce vaccine responsiveness also. In the age group and diabetes, there's a chances of vaccine responsiveness also, but that is less if proper time we give this vaccine, then chances is obviously less and increased susceptibility to infection. Geriatric age group itself is a susceptibility to infection. And then along with the diabetes, obviously you know that diabetes also the chances of susceptibility to infection is much more. So elderly plus diabetes, that means ultimately double immunological burden. So that is important aspect, and I must thank you to the Day organization for putting this very important aspect, as because they are aware the common people or the educator about the diabetes, but along with diabetes, they are thinking about the geriatric patient also, geriatric age group also. And I must thank you as a geriatric practitioner that we have chosen this geriatric age group for this awareness. And Major vaccines, what we are, the vaccines preventive diseases, what we can actually prevent that by vaccination. That is, actually influenza, pneumococcal disease, herpes zoster, then hepatitis B, then Tdap, that is the tetanus, diphtheria, and pertussis, and the respiratory syncytial virus that affected the lower respiratory tract. So that these diseases can be prevented if we provide the vaccination. So that is one important message. Sometimes the patients are asking that after taking vaccine, the disease will not happen. No, that assurance we cannot provide. Any vaccine, except some few vaccines like oral polio vaccine and that sort of things, they have the 70% efficacy, 70 to 80% efficacy. So there is a chances of 70 to 80% not have, affected by that disease. But that 70-80% guarantee is much more. Who will give you that 70 to 80% guarantee? And another very important, that is, along with that, it is not that vaccine always prevent the disease. It can prevent, but it happen also. What is the result? The result is that the prognosis become very positive. That means less chances of hospitalization, less chances of that sepsis related or that serious complication, that sort of things. That may be possible by if we take the vaccine. So vaccine not only prevent, it can help to what the prognosis of the disease, positive outcome of the prognosis of the disease. So that is also important thing. Clinical benefits of vaccination in geriatric is the diabetes. What are the clinical benefits? The clinical benefit is, first of all, I have already mentioned, that is the reduced hospitalization. Then the lower mortality. The chances of death becomes much more less if they have taken the vaccination. Better cardiovascular outcomes. Cardiovascular outcomes means our heart-related complications, if happens also, that's become much more less serious than if they are not taken the vaccine. So that then obviously in the improved glycemic stability or glycemic control in the diabetic patient is very much required actually. So that is also the important aspect of the clinical benefits of the geriatric diabetic patient. Then reduce secondary complication. That is usually that when we are affected by any disease, some secondary complications are there. It is secondary to that diseases. Okay, so secondary complications like even that secondary complications of diabetes are that there are chances of affecting the kidney, chances of affecting the heart, chances of affecting the brain, chances of affecting the soft tissue, chances of affecting the nerve and neuropathy. So this sort of secondary complication, that chances also become less if the vaccination is there. Then obviously, because of these all, improve quality of life. This is a very important QOL, quality of life. Ultimately, our goal is in any disease or any situation. What is our goal? Any treatment. The treatment, first one is a curing. Or if not cure, actually maintain the normal parameter. And then what is the reason? Reason is actually to improve our quality of life. Whatever may be the stages. Okay, in case of geriatric aspect, when we are discussing about the geriatric patient, the geriatric age groups are what? Above 60. In India, 60 is the cutoff marks of the geriatric age group. The above 60 in Western country, that is usually 65 and above. So 60, now the lifespan becomes in India, the normal lifespan becomes 72. Okay, 72. And normal average lifespan. And now I have seen the many patients, rather we say many people, They live 90 years, more than 90 is 100. I have treated 102 years patient. And now at present, my patients, three or four patients are nearly 100, 98, 99, that sort of patients are there. Four patients I have. So this quality of life, so that depends. When the stage is the 60 to 70, we call the younger old age. 70 to 80 is the middle old age, and more than 80 is the super old age. Obviously, because of the degenerative changes and that sort of things, obviously, super aged old people are much more prone to infection, much more prone to the degenerative changes of like diseases, effect of the diseases, effect of the degenerative changes, like their chances of increased osteoarthritis, increase the cognitive decline, increase other decline, even the diabetic uncontrolled, that may be possible. So, but some patients maybe they are confined in the bedridden patient. But every individual has right to live the proper, dignified life along with the more accessible and what achievable quality of life. Whatever may be the stages. Even the bedridden patient also right to live the most achievable quality of life. And in that case, that depends on us. Depends on us means the family members, the physicians, the caregivers. Actually, some patients of the geriatric history, they are totally dependent on this because they are even for performing the activities of daily living, normal activities like bathing, like brushing, like wearing the clothes, like even toileting, movement, feeding. These all minimum activities of daily living. They depends on the others. So this is our responsibility to give the most quality of life, the most better quality of life. So in that aspect also, if we provide the vaccination, it's not that okay, the patient is bedridden, so not required to vaccinate. Why the bedridden patient confined in home? So chances of no chances of infection? Absolutely not. Absolutely not. Be- Even rather, their chances are more. So we should not ignore or overlook that sort of patient also. So that, and along with all this, reduce healthcare costs, because if one hospitalization that leads to million of yeah, million rupees we have to give the hospital. So if we can prevent hospitalization, so the healthcare cost that is also reducible. So that is the main things. Then your is the vaccination in elderly. What why this vaccination in Indian perspective? Why this more important? Globally important, but Indian aspect, same thing, the rising in elderly population, high burden of the respiratory infections and sepsis. Indian populations are suffering from many sort of respiratory infections like COPD, chronic obstructive pulmonary disease, like pulmonary tuberculosis, like another event I have seen some of patients that they are suffering from interstitial lung disease, that sort of thing. So high burden on the respiratory infections, the sepsis, the geriatric age groups in India, and not only India, globally also, the same scenario in globally also. Poor nutrition. Poor nutrition for two aspects. One is financial aspect. The many patients, many geriatric people, they are financially not able to purchase quality food and fruit. So that is one thing. Another thing, not financially, they are not capable. Not they are capable, but why they are suffering? Because especially the in the age group, those who are in the super aged, those who are dependent on the caregivers, those who are dependent on the they are bedridden, the cognitive decline, dementia patient, Parkinson patient. In that case, the caregivers are so reluctant, so overlooked that they provide the monotonous food every day. And for that reason, they are not taking the food. They are not properly cooked the food. Storage is also not proper. Only because of that, they are taking meal, but adequate nutrition is not going. So that ultimately leads to malnutrition, and that that ultimately that also leads to home for the infection, and where the vaccination is the positive effect. And delayed diagnosis because of the negligence, because of the unawareness. Huh? So delayed diagnosis is also there. And the elderly people in India, they are suffering, many of them are suffering from chronic kidney disease. They are suffering from different sort of cardiovascular diseases. And another very important I mentioned, that limited adult vaccine awareness. Sometimes even they are asking adult, old age, vaccine. Vaccine, I know the vaccine is only for children. Why adults? Why older people should take vaccine? This sort of conception is there, even in the educated people. Not, I am not saying about the uh, marginalized people. I am saying about the educated people. Oh, don't, nothing will happen. So that sort of thing, that sort of heroic attitude, sometimes when some patients are there. So that sort of things are there. So this is another very important aspect. Positive impact of the vaccination. The 30 to 50% reduction in the hospitalization rate, 30 to 50% reduction. Then another very important, what I have mentioned in the earlier, like if we take vaccine, disease may be happening, but the outcomes of the disease is not so serious. Outcome of the disease may not cause the hospitalization, even if the hospitalization is also happening. ICU admission may be prevented. So lower ICU admission, reduce cardiovascular events, better long-term survival. That is also important. 46% reduction in all-cause of mortality. 46%. That is a very significant percentage. And 9 to 11% reduction in the pneumonia hospitalization if we take the vaccine, especially the pneumonia vaccine. This is not my study. This is the reference I mentioned. So this is a positive impact of vaccination. So now the question is, what are the recommended vaccines for the elderly age group? And first is influenza. That is, annually we should take the influenza vaccine. Second is the pneumococcal. As per age and race, it depends on, and I will come later. Third is the zoster, herpes zoster, to prevent the herpes or shingles. That is the 2 doses. What 2 doses I will mention. Second, then the Tdap, mainly the tetanus. Diphtheria and pertussis not so common, but tetanus, so every 10 years. Then hepatitis B, that is also depends on not all your yeah, older people should take hepatitis B, but those are prone to take injectable medication or saline, blood transfusion. Okay, those who are engaging any healthcare related jobs, maybe after 60, they are working in the hospital. Maybe nowadays, the many 60 to 70 people are working in the different places. So if they are related with the, any healthcare related institution, so in that aspect, and that respiratory syncytial virus vaccine, that older adults, it is not now available in India, but in other country, Western country, these are available. So these recommended vaccines. And mainly, I will mention influenza, pneumonia, pneumococcal, then the herpes zoster. These three vaccines are very, very important in the geriatric age group. So influenza vaccine. Geriatric influenza vaccine. So influenza vaccine reduces hospitalization, reduces after taking our influenza vaccine, This picture is actually the true picture of our organizational member, and this is our Dr. Swarnapali Maitri. I will not disclose the very name, but she has given the consent to use the picture. So that so this is the actual picture what we are giving the vaccination in their home. So that reduces hospitalization, reduces cardiovascular events, prevents the secondary bacterial infection. Influenza is very simple thing. What we call the common flu. বাংলা যেটাকে আমরা if the Bengali সর্দি গরমি হয়েছে, ঠান্ডা লেগেছে একটু, সেই ঠান্ডা লেগেছে একটু, that becomes ultimately not একটু, it becomes wider aspect, it becomes serious if not treated, and it leads to even the respiratory complication and hospitalization. So that secondary, ultimately what happened, the bacterial infection is happened. Started with the influenza. Influenza is a virus. So viral infection. But ultimately it leads to the secondary bacterial infection that leads to pneumonia. So that may be prevented by taking influenza and lower mortality in elderly diabetes. So this is important. Then pneumococcal vaccine. It protects pneumonia. It protects from the meningitis in the brain. Meninges is the layer of the brain. That infection, the meningitis. Bacteremia, the bacterial infection through the blood, sepsis, that can be preventable. So, pneumococcal vaccine. Then, what groups are higher risk of this pneumonia? That is the diabetic patient, diabetes, the chronic kidney disease patient. They are uh, 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 higher risk. Then cardiac diseases. Those are suffering from the cardiac diseases like your ischemic heart disease, like acute myocardial infarction if history is there, coronary artery diseases are there. So that's for the cardiac diseases. And usually pneumococcal vaccine recommended to provide after age of 50. After age of 50, that pneumococcal vaccination. So that is the usual recommendation. Herpes zoster. Herpes zoster prevents the herpes. You know the herpes. There are two types of herpes, usually simplex and herpes zoster. Herpes simplex, that is usually happen like just a distal, like not distal, like a small lesion, usually in the angle of the leaves or in the leaves. Okay, usually mild low-grade fever, that sort of, or myalgia, arthralgia, that sort of things. These are common. These are not so serious. But when it is affected by the herpes zoster, that is very serious complication. And geriatric age group patients, they are prone to infected by the herpes zoster or shingles virus. This herpes zoster that leads to what? First of all, the very uh, uh, disturbing complication. Why I am saying disturbing? Because not only pain, but irritating, burning sensation, crystal-like formation, and this is usually in the one side because it affected in the, or it becomes spread through the nerve root, one nerve root. So one-sided. Yeah, even I have seen in my patient the herpes infection happen in the eye. So this the period of that complication is so distressful that only the affected person can say. But along with that, another very important, that after curing of this lesion, the second thing is the post-herpetic neuralgia. This post-herpetic neuralgia is the nerve pain, and it can even possible that prolongation of this nerve pain even after 1 year of this infection. Even 5 years of infection sometimes. Consistently, these nerve pains often are going on. So that's why the herpes is just infection is serious alarming for the elderly patient. And if vaccinated, we can prevent. Sometimes some people or patients are asking that in the childhood herpes was happened. Why this again in the older age group? And even sometimes they ask question, is it actually happen in the old age? Why this is just propagating or promoting or marketing aspect, this vaccination and that sort of things? Actually, nothing. No, for your queries, the usually even if anyone is suffered from the herpes zoster infection in the childhood, in the younger age, the virus remains dormant, and when they get the favorable condition to flare up, that is actually happen in the old age, and ultimately that flare up ultimately becomes the infection of the herpes zoster in the old age group. That's why this is important. So recommended after age of 50, but usually we say that usually 50 is not the geriatric age groups, 60 and above. So, but recommendation is after the age of 50, you have to take the herpes zoster vaccine to prevent the shingles or herpes zoster. Then the considering the diabetic aspect, diabetic patient, best timing for the vaccination when the blood sugar is reasonably controlled. Okay, reasonably controlled. No acute infection or febrile illness is going on. When actually we are choosing the timing in that period, no acute infection or febrile illness is going on. That's why that should be uh, by doctor. Doctor is only say that no infection is going on because sometimes some infection is there, some test findings are there. The patient is thinking or the person is thinking, oh, okay, nothing is there, but actually there. So I always mention that before giving vaccination, the doctor should recommend that, okay, now you can take, or there's a no harm to take the vaccination. So that's why one thing. Another thing, I always mention in every situation, if possible, in presence of doctor, you just take vaccine. But if not possible, at least for the first time, where the second time, third time vaccinations are required, or in the single dose, you have to take vaccine in presence of doctor because even the chances is rare. There is a rare chances of anaphylactic reaction, allergic reaction to the vaccine. So if that happened, to combat that situation, the preparatory stage, preparatory arrangement should be there, and doctor is the only person to what treat that case in acute stage. So that's why always it's not that okay, doctor, then where I have to pay the doctor's fees. Why I should pay? More than that, better is to take in the pharmacy and that pharmacy person will give you injection. Okay, in 99% may not be happen nothing, but in 1% chances that pharmacy boy will able to combat the situation. So why we should take that risk? So should not take risk. So that's why in presence of doctor, no acute infection before hospitalization or surgery should not take. And before flu season, usually we are taking in there is aspect of the influenza. Usually that are not recommended. The why what is the actual period for taking the best period? I come later. So do not very important aspect for the diabetic aspect is do not wait for perfect glycemic control. Okay, when the HbA1c will be below 6, I have to wait for that period. No, nothing required. Okay. And even you know that in the older age group, usually older diabetic patient, the HbA1c level we prefer to that is in nearly 7. Okay. is not so aggressive treatment is not required, especially in the older and super older age group. So do not wait for perfect glycemic control. Vaccinate when clinically stable, and that clinically stable should be judged by obviously doctor. So that is the important thing. Influenza vaccine, when we have to take, best time is the September, October in the Indian subcontinent. When considering the Indian subcontinent, usually tetravalent and quadrivalent, and we use quadrivalent influenza vaccine. And we use, there is a two hemisphere difference in the northern hemisphere, southern hemisphere. Usually there are some, what, some uh, your suggestion. There is a differences of the suggestion or advice. Some physicians prefer northern hemisphere that related that strain. Some prefer doctors prefer southern hemisphere. We usually prefer southern hemisphere. Uh, uh, yeah, related southern hemisphere uh, strain related influenza vaccine. That is actually made by the different your international pharmaceutical organization. I have not mentioned any name. You know that some globally acclaimed two to three pharmaceutical organizations are there. They are making these vaccines, so you can take any one of them, and you have to uh, take advice from the doctors, your physician. Then annual vaccination recommended annually one time, usually September, October. It's not that, okay, October is missed, then, okay, can I take? Yes, you can take. You can take any time. Can be given any time during season. Can be given any time. What happened? If anyone has taken the vaccine in the February, can he or she take? Yes. Then the span of this preventable span, that will become less. It's not that they're not effective. That will become less. Ultimately, the next dose he or she should take in the September, October. That time. It's not that wait for one year. It's not that. Okay, for the influenza vaccine, I have to mention that influenza vaccine. Okay, so that is one thing. Pneumococcal vaccine, already mentioned, about 50, anyone can take. Especially earlier, even about not 50, earlier 50, those who are suffering from chronic kidney disease, COPD, heart disease, they can take. Nowadays, in the last 1 year, before that, actually, in India, two vaccinations we prescribe. One is, we call, there are two sort of vaccine. One is called conjugated vaccine. Another is called polysaccharide vaccine. One is PCV30 and pneumococcal polysaccharide vaccine PPSV23. Some of in the patients or in the people may take, may already took that PCV13 or PPSV23. Usually the dose is, if we are considering the PCV13 and PPSV23, usually first we have to provide PCV13. Just 1 year after, we should provide PPSV23. Usually it says that not required to take any further any vaccination. Usually 5 years gap, that conception, that is also there. It is only related with those who are taking only PPSV23, that should be repeated after 5 years. And after 5 years, if then after 1 year, if he or she take the PCV 13, then also completed. But nowadays in India, PCV20, pneumococcal conjugated vaccine 20 is available. And it is only one-time vaccination. Single vaccination is required to become vaccinated against pneumococcal. Okay. So now PCV20 is commonly preferred just to avoid that sort of confusion, that sort of things. To what happened if PCV 1 year gap is more than 1 year gap is happened, what happened? That sort of confusion, to overcome that sort of confusion, if those not taken PCV 13 or PCV PTSD 23, they can take PCV 20 single dose, and those even that recommendation is there, those they are already taken PCV 13. They can also even taken PCV 20, and that is the ultimate dose. Nothing is required to continue or taken further. So that is the pneumococcal vaccine. Herpes zoster vaccine, already mentioned 50 years and above. There are two dose. One is the day zero means when you take, that is considered as a day zero. Then after 2 to 6 months later, in between any of that, you can take the dose two. That is enough. Dose one is day zero. Then dose two within 2 to 6 months later of the first dose. So that is the herpes zoster single vaccine. What is the hepatitis B vaccine? Usually, hepatitis B vaccine, as we are here discuss about the diabetic elderly, and that's because of the diabetic patient, those are uh, because they are much more prone for the infection from the other non-diabetic patients. Usually, unvaccinated diabetic adults, even or I have already mentioned that those who are in the dialysis or institutional care, or those who are exposed, maybe exposed or required to expose for IV related medication, injectable medication, in that case, they have to take hepatitis B vaccine. And schedule is very simple: zero, then 1 month later, then 6 months later. So 3 doses, zero, then 1 month later, then 6 months later. Okay. So this is hepatitis B. Tdap booster. There is some misconception about the tetanus. Every time any even small injury, usually common people are taken tetanus vaccine. Tetanus dia, tetanus dia, tetanus দেওয়া হয়েছে. No, every single injury patient not required to take tetanus. TDP here, three vaccine actually combined: tetanus, diphtheria, and pertussis. On one adult TDP, one dose is enough. Booster in every 10 years. Booster in every 10 years. And it is mainly diabetic foot ulcer, diabetic that sort of complication, trauma risk are there, chronic wounds are there. They have to take this TDP that vaccine. But every 10 years, it's not that every situation we have to take. Another one thing is there, if usually after if we take vaccinated within 5 years, small injury does not require to take any tetanus vaccine. But if big injuries happen, usually we say that if more than 5 years, then we have to take one vaccination, the tetanus vaccine. If big injury, big chances of lesion, that sort of thing, big exposure, that sort of complications are there. So usually another one thing is, if any surgical intervention is going on, usually in practices in the surgical intervention, before that vaccination is given. So nothing to require to take any further vaccination if after surgery it is less than 5 years for the big injury, or less than 10 years for the very small injury. So this conception is, we have to clear the conception that every trauma, every injury not required to take tetanus vaccine if it is vaccinated within 5 years or 10 years. Okay. So that is very important, and that is also applicable for the elderly age group as well as elderly diabetic age group. Some contraindications. I have already mentioned some contraindications are there, but don't become panic. In our nearly 350 elderly age people, they have taken their vaccine through us, means through our organization. And we have seen no anaphylactic reaction. I have again mentioned no anaphylactic reaction in single case. Only 5, 6 patients, or we say members, they suffered from that not so much abscess, there's abscess like the preliminary abscess like or some pain or swelling. It is not because of the any component of vaccine. It is because of muscle tear. Okay. When the injection is provided, some cases maybe the very hard and maybe that not properly injected because of the restlessness, maybe sometimes happen. Only because of that, some small abscess like formation, very much treatable and even not abscess even, just initial stage, just some swelling pain or that inflammation, and usually by just anti-inflammatory medication, even some slight, just by simple paracetamol, and some 2 to 3 cases require antibiotic, but nothing else. So this is my message to all that don't become panic. That from vaccine, this happen, it will happen, it may happen. No, okay, chances are very, very less. But sometimes 1% chances is there. So 1%, that 1% is anaphylaxis to vaccine components. And severe allergy. This is absolute. Temporary, what I said, I have already mentioned, acute febrile illness, sometimes fever like the myalgia, fever, that sort of things. Diabetic ketoacidosis is very rare or hyperosmolar state. And hemodynamically instability, pressure becomes sometimes less, pulse become high. So that is very temporary and usually not very important message that is clinical part. Diabetes is not a contraindication for any vaccination. Clinical instability is obviously that we have to aware, we should be cautious. That is another thing. But diabetes itself is not a contraindication. Rather, diabetes is very much what important aspect for taking the vaccination. And if diabetic patients, especially the elderly diabetic patients, are vaccinated, I already mentioned their quality of life become much more improved. Their chances of infection become much more less. Chances of hospitalization become much more less. Chances of secondary infection or secondary complication become much more less. So several positive factors are there if the diabetic patients and especially the diabetic elderly are vaccinated. So challenges in adult immunization in Indian perspective, what challenges? First of all, already mentioned low awareness, hesitancy, so because of the some going missed opportunities in clinics, obviously cause barriers sometimes because even till now, this is not in the national vaccination schedule or immunity schedule. So the people have to buy this vaccine by their own cost. So that's why. But we are fighting for that the national immunization program should include the geriatric vaccination, geriatric age group. There is a rural-urban healthcare gap, definitely. Rural people are much more prone or their vaccination rates are so low. And policy of implementation challenges, these are there. And I have to thank you again, the Day organization, for awareing that. And if this sort of awareness is going on, then the government will be compelled to think. So ultimately, conclusion, vaccination means the healthy longevity. The longevity is required, but longevity should be healthy. So healthy longevity. Evidence shows vaccination in elderly diabetes reduces mortality, reduces hospitalization, ultimately healthcare expenditure, and reduces the functional decline. That is the ultimately quality of life. So, what is the ultimately take-home message? So, assess, then educate. That is already doing by the A organization, and thank you to give the opportunity to become the part of this program to the organizer. So assess, educate, vaccinate, and that should be documented, obviously, because that's complications are usually happen when pneumococcal vaccination. What vaccines? PCV13. Oh, I cannot remember PCV13, PPSV 23. So if that's a properly documented, that confusion we can overcome. So confusion documented, that should be documented and obviously documented. So ultimately, our aim is to, by giving the vaccine, we have to provide quality life, enjoyable life, and to the what elderly age group. And these elderly age groups are known as the second innings of life. So I think by vaccination, by our approach, by our extended hands, our elderly people will be happy to live their second innings. Okay, thank you very much.
Thank you, sir. Thank you for such a valuable and insightful session. Sir, we have few questions in our Facebook chat box. May I take the questions?
Yes, yes.
Yes. Uh, Many elderly people with diabetes feel আমি তো ভালো আছি and vaccine লাগবে না. Why is prevention still so important even when someone feels healthy?
Mention that
Yes.
healthy means your parameters are good. Your diabetes, I think, yeah, the sugar level is controlled. Your other vitals, the pressure, that's going control. Your devoid from any infection. That sort of things you are mentioning the healthy. But if you can be exposed to any infection of this influenza, this pneumonia, this sort of herpes zoster in any time. So that infection will cause what will affect you, and for that you can suffer. And if those are diabetic, so always not that our diabetes levels are so controlled or maybe well controlled. Sometimes maybe the chances of uncontrolled diabetes is there. When this uncontrolled diabetes, you know the vice versa is going. Diabetes leads to infection, and infection are much prone in the diabetic patient. So why should we take the risk when the chances of risk are so less when we can take the vaccine? I have mentioned the 70 to 80% efficacy. It's not that 100% efficacy, 70 to 80% efficacy. That means we can prevent 70 to 80% chances of prevention is there. And it also happen, I have already mentioned, that chances of hospitalization, chances of secondary infection, that sort of things are much more reduced, much more less. So why should not take the chances of that?
Thank you, sir. Thank you. Our second question: people with diabetes often take many medicines already. Some families worry about vaccines may create extra problem in old age. How should common people understand the safety of this vaccine?
I already mentioned with my experience, it's not only theoretical. It's my experience. I have already mentioned that we have given 350 people. 350 not not a small case. More than 350 elderly people have vaccinated with our guidance. Okay. And they are living quality of life much more better. Those who are commonly affected by the common cold after taking the influenza vaccine that are used, the chances of COPD, even the exacerbation of COPD, that become less. I've seen that. So, okay, you have mentioned that polypharmacy, multiple medications are going on. The doctor will judge you, and usually in study also shows there is no adverse effect of that vaccine along with if we take multiple medication. No, that is not there. So you can take. I assure you that you can take easily, and the patient quality of life will be much uh, healthier if you can take this vaccine. Especially, I have mentioned two vaccines, mainly influenza and another is pneumonia. These are the main burden of the elderly age group. Yes, horticulture is also happened, but not so much like influenza and pneumonia. So at least you can take these two vaccines. Don't think about the cost. Okay, we have spent many cases in many other reasons. We spend some money. So why not we spend money for our areas? So that's why I'm assuring you that there is no contraindication of vaccine if we take many medicines. Okay.
Thank you, sir. Thank you. Sir, one more question is there. If someone takes a vaccine in June 1 year, but delays the next dose until September, does immunity remain fully protected during the gap period, or can protection reduce in those extra months?
Again, what June? If anyone take June, then
And next, he will take the vaccine in next year September. So, does the immunity remain fully protected during that gap period, or can protection maybe reduce on that period?
fully protection is not there because it is actually relevant for the influenza, not pneumonia and other.
Yes, yes.
Because it's only for the annually given that vaccination. Usually, what happens? These vaccinations are made according to the strains of the viruses which are predominant at that season. So this is actually scientific based and research based. So in that cases, that period may not be fully efficacy will be there, but some efficacy obviously there. But if that strain which are common for that season, it will infect. Maybe infection is chances of infections.
Thank you, sir. Uh, and also thank to all our participants and audiences for your patience, for your engagement. Thank you. Sir, before conclude the program, we would like to express our heartfelt gratitude to you for taking time out of your busy schedule to be with us today, and for sharing such an insightful session. We look forward to organize such session with you, sir. Thank you, sir. Thank you. Good night.
Thank you. Thank you. It's my privilege and honor also. And I don't know actually if participants have not seen the live program. So thanks to all participants also. And my message to all the participants is convey this message, forward this message to your known contacts. Okay, it's our art because by that or spreading, we can spread the message and we can keep the quality of life to the mass elderly people. Okay, thank you. ভালো থাকবেন
Thank you,
আপনারা
sir.
সবাই. Thank you.
Good night, sir.